Yeah, perfect. So cancer is the first thing that got me excited. When I was still working as a paramedic, I was learning about people that were reversing their cancer naturally, and that got me so excited. And then it made me go within myself and say, why am I just now realizing this? Of course we can reverse this. It's not a disease, it's not a killer, it's the body saying, hey, we've been trying to get your attention, we need help. So it's absolutely reversible. Our diet and lifestyle is just more and more things. It's harder and harder to be healthy, but there's so many things that you can do for yourself. A lot of it starts with your mind, your emotions, your environment, your relationships, what you put into this body, what you allow. So I just published a journal because this is part of the journey. It's a prompted journal.
Mhm.
Your mind and your emotions affect your health. And when you have a low resonance with negative thoughts and negative energies,
Right.
you create an environment of negativity and low frequency, and that's where disease harbors, whether it be cancer, diabetes, heart disease, anything. Low frequency. Cancer starts at 42 hertz. And if your frequency gets that low, you're prone to cancer. So the first thing I work with people is get your emotions healed, get rid of past traumas, get your mentation, start changing these old bad records.
Mhm.
We've got to clean up the diet, the environment, just everything. There's so many things that people can do.
Yes.
Do they always do them? Do they want to do them? You know, that's the hard thing. I have so many people that will come and I'll tell them the things that they need to do to get well, and they just don't want to do it.
Hmm.
That's heartbreaking
Yeah.
because it's not that hard.
No, and again, then it's a question of how bad do you actually want to live, right? Because
Right. Well, people will just tell me, I'm not going to give this up. I'm not going to give that up. And I said, do you realize that that's what's led to your cancer? Because
Mhm.
if you keep doing the very same things you've been doing, you're going to keep getting the same results. If you want something different, you have to do something different.
Yes. Well, and
And
the
that's
other thing is, even aside from disease, cancer, symptoms, whatever you want to call it, the reality of it is that most of us don't even realize anymore. Well, first of all, we're not necessarily in touch with how we feel. Second of all, we're not necessarily in touch with the fact that we don't feel as good as we used to, because again, this is health on a slow and steady decline. So you don't really realize, oh, actually, I don't feel as good as I did 6 months ago or a year ago or whatever, right? Until you eventually end up in the progression where you're right, the body exhibits signs of disease, as in cancer, diabetes, whatever you want to call it, right? But we're so conditioned to not actually understand how we feel and how good we can feel and how good we're meant to feel, right?
Exactly. So what really got me excited when I worked as a paramedic was the 90-year-old ladies that I'd go pick up because they had a little accident, still working on the farm, still taking care of everything, not taking any medications, no
Yes.
disease diagnoses,
Yes.
just spry and I was like, wow, these women are really strong and healthy, but they're such the minority anymore because we've been
Yes.
conditioned to think that bad health is normal.
Yes.
And we've been told, oh, well, you're getting old. My family
Yes.
uses this all the time. Well, just wait till you hit this marker and wait till you, and I'm like, okay, well, I'm there and these things aren't happening.
Yes.
Why is that?
Yes.
Because I stay in denial and I choose a better path for myself.
Yes. Yes, that whole you're getting older, that's one of my pet peeves, right? It's like, oh, you're getting older, that's to be expected. It's like, said who? Said no one ever.
It's a number.
Yes.
It's not a condition.
Yes, we went to Mexico a few years back, and they took us to one of the villages, you know, where they have like no power, no electricity, no nothing, right? And there's this little lady sitting there, and she's squatting down, and she's making tortillas on whatever the little thing is that's going around. And she's smiling the whole time. She doesn't understand a word of English, but she's smiling at us the whole time. And I'm thinking, I wonder how old she is. She was 89. 89. She had no arthritis in her hands. She was obviously, like I say, I don't believe she understood a word of English, but she was obviously in very good spirits and in very good health. And then she got from that squatting position where she was for half, 3/4 of an hour and just stood up. 89? Most women at 89 can't cross the street, never mind squat for half an hour and then stand up, right?
50-year-old women can't do that.